New videos every day.
Hi, Ron again. So I'm going to show you some stuff we can do on the ball to open up your torso, get your ribs back. I'll show you those massage techniques on the ball. It's you probably don't learn in school or anywhere, but anyway, Charles again, and he's going to be sitting on the ball, and he's going to roll on back, lay on your back. There you go. Now, wow, you're stiff, dude. So you should be able to relax all this, and you should have a good, your back should open, your chest should open up, and his head should be able to come back comfortably. He is, forward a little bit more. All right, so there, he can't even, look at this. How restricted he is there. All right, as you can see here, Charles has a little difficulty opening up here. So remember, your head should be on the ball, okay? If you cannot do that, you might want to cheat back this way and start from the beginning and kind of work your way and keep your head on the ball, open up. Because if you're really restricted, if your head is up like this and you can't touch it, anyway, you need help. But anyway, so what I was gonna say about some techniques of massage, I know this looks kind of weird, but this works, okay? So what you do is you kind of push and open up the rib cage here, okay? You can open up the chest while he's on the ball. The ball actually helps you give. Instead of pushing down on a hard surface, this actually helps the rib cage to open up and get some mobility and some movement. So, all right. And then you can go back more, keep his head on the ball. You can open up, you can kind of pull this way, same thing. All right. So earlier we were talking about how you get pain radiating from your glutes all the way down to your feet. You know, one thing that I find with the spine is that sometimes people really get that dip, and so it's hard to, on a flat table, to get the vertebrae to loosen up. So sometimes they use the ball, and what that allows me to do is actually get to move the spine here and get in the sacrum between the pelvis area, and so there's a lot of tissue in there, and so you know I can kind of go like this. I know it looks kind of weird, but this gives me a better angle to get some movement. You can see how the pelvis is moving. You can also do like this because you want to push the pelvis back to open up that space for the sacrum so all the nerves that glide in there can open up. So you can see how it's moving. And I can, like I said, follow the spine and break up any scar tissue here that may be on the sacrum. Break that up there because you can actually feel the vertebrae moving. Sometimes there's so much scar tissue they won't be moved. It's solid, you know. So you kind of break it up this way. Like I said, do this. Go down the back, and you can feel the rib cage kind of moving with the ball. So, all right. Visit my website. Give me a thumbs up. Leave me a comment.